Hi, this is Jack Meligan coming from Plaintiff's MSA and Lien Solution with you today. Hey, there have been some recent activities in the Medicare and MSA space, specifically the liability MSA space. Thought I'd bring you a video today and give you a little heads up. So the three things that have happened this year are that in January, the Department of Health and Human Services issued a budget for 2017, and it includes a line item indicating that CMS is requesting legislative authority in a budget to develop a fund collection process for future medical care cases. That was the first thing. Then in April, CMS modified an RFP that they have out for a workers' comp review contractor. And they specifically updated the statement of work to include the review and processing of non-group health plan MSAs. And non-group health plan MSAs means essentially liability and no fault and self-insured cases. So that was the second thing. Then here last week, CMS formally announced that they are considering expansion of the review process to include all voluntary liability MSAs. So taken by themselves separately, not necessarily earth-shaking news, but the three together certainly are pointing that perhaps Medicare CMS is finally turning its attention towards liability MSAs. So what does this mean? Is it time to panic? No, not at all. Not at all. In fact, I think it's business as usual, because anything that CMS is going to do is going to take them at least a year to roll out after they get done with public comment and so forth. So best practice is still the best practice that we've been commenting on all along, and that is have a conversation with your client. Tell your client that if they have a Medicare card at the time of settlement, the defendants are required to report that settlement to Medicare, including the injuries and the conditions that are the subject of the settlement. It could lead to Medicare putting two and two together and at a future date denying payment for certain bills that have been submitted to Medicare for the conditions or the injuries that were the subject of your client's settlement. Next conversation to have is the client a gambler or are they a protector? Medicare is still the most messed up bureaucracy in the United States government. That doesn't mean that they're not going to get their act together someday, and in fact they're working hard to get there. But for the time being, we know that their enforcement of their secondary payer right has been spotty at best. It's inconsistent and inconsistent around the country. So many people have taken the position that they're going to gamble that Medicare never catches up with it. And that could be a definite possibility. I understand that position. Some people our claimants are already upset at how much Medicare, Medicaid, ERISA plans have taken out of their settlements for lien resolution, and they just don't feel like setting aside any money. But if your client is a protector type, they want to protect themselves from any future possibility of Medicare denying payment for bills and the client not having the money at that time to pay for those bills, then perhaps that's a client that you should have a conversation about possibly creating a voluntary MSA. And by that we mean an MSA that has been minimized to the lowest reasonably defensible number. And that way they've got a pot of money that can pay future Medicare allowable bills. And if Medicare ever comes back after having paid a bunch of their bills and expenses for treatment related to their settlement and wants repayment, then they have a fund where those bills could presumably be presented and paid from their own MSA account. So that's it for today. Thanks for listening, and if we can help you in any way, give us a call.